We'll go ahead and get started. Good morning, everybody, and thanks for joining today. Today we have Dr. Ellen Eaton, Assistant Professor in the UAB Division of Infectious Diseases. She's going to address safety as we approach the Easter weekend and Mother's Day weekend and other spring holidays, general vaccination questions, and a state of where we are as a country and as a state with COVID-19. She will not be able to answer any questions regarding the UAB community vaccination sites. If you have questions about those, you can submit them to us and we will try to get an answer for you. If you have any questions, you can submit them through the chat or you can raise your hand through Zoom. We will make a recording available shortly following this. And I think we'll go ahead and get started with Dr. Eaton. She has a couple of opening statements, and Dr. Eaton, the floor is yours.
Thank you. Good morning. I want to start off with a brief update. We remain very enthusiastic about the available coronavirus vaccines and increasing accessibility to vaccines, but only a minority of Americans and Alabamians are fully vaccinated. In addition, we're seeing more transmissible coronavirus variants, which are now widespread across the U.S. And we know that there are many variants in popular tourist destinations like Florida. These changes plus spring break travel may put unvaccinated individuals at risk for these more contagious variants, and relaxations in public policy such as masks could contribute to a growth in cases. We haven't seen a significant increase in our community just yet, but we need to follow the testing rates and cases closely as we see restrictions relaxing in the next few weeks and months. And this is especially important as we approach holidays like Easter and Mother's Day, where unvaccinated people may be more likely to gather indoors for shared meals and gatherings. So really the bottom line is that we need to continue doing all the measures that have kept us safe for the last year, masking when indoors, avoiding gatherings, and getting outdoors really as much as possible. Thank you.
All right, thank you. We have a couple of questions already submitted for those who couldn't join us today, so we'll get to those, and then I see one already in the chat. The first question is from Mike Royer with WVUA. He says, I understand the number of people testing positive after receiving one or both vaccines is quite low. But now that we are a bit further into the vaccination process, do we have numbers on what percentage of vaccinated people then test positive?
Yeah, that's a great question. We're still gathering data, especially here locally, but we have seen in the last week some data from other states that a very, very small percentage, like we're talking less than 1%, more on the order of 0.1% of individuals who are fully vaccinated may have what's being called a breakthrough infection, a breakthrough coronavirus infection. Most of these cases are mild. And again, the breakthrough infections are very rare, but we do see this with other infectious diseases and other vaccines. So it's not too terribly surprising. And we're encouraged that these infections are rare and mild for the most part.
Okay, thank you. Next question comes from Alan Collins with WBRC. He asks, is Alabama ready to open up vaccinations to more groups? Are there any concerns about supply or frustration of people trying to get their vaccines quickly?
Yeah, we're really hopeful. We're hearing about more and more individuals who are able to access vaccines in our community and really our states. I'm hearing very few patients who are eligible who are having a hard time accessing vaccines in the last few days and weeks, and that is a change. So I'm hopeful that as we hear about more vaccines available, more vaccine sites, that we'll continue to see more and more of our Alabamians getting vaccinated.
Okay, thank you. Next question comes from Amy Kingsley. The CDC is expected to announce that vaccinated individuals can travel nationally and internationally without a test as long as they mask. Are vaccinated individuals safe to gather for the holidays and travel?
Yeah, so that's a great question. And really the devil is in the details. So we know that the vaccines are very effective. We know that folks who are fully vaccinated are largely protected when gathering in other largely ventilated space with other vaccinated individuals. Where we start to come into trouble is where we see individuals in close spaces without mask, sharing space, sharing air. As I mentioned, there could be, even if the flight, for example, is fully vaccinated, there could could be a breakthrough case, as I mentioned, and being in a tight congregate setting like an airplane for prolonged flights, especially without masks, would be a higher risk environment. But if everyone is wearing a mask, if we are getting as many individuals vaccinated as possible, we can reduce the risk with travel. I personally am not traveling yet, and I would encourage folks to stay closer to home until we get more Americans vaccinated. Remember, only 15% of Americans are fully vaccinated. So that's going to be a minority on your flight, a minority in your carpools and bus travel, other travel. So I would really encourage people to stay closer to home if at all possible.
All right, thank you. And just a reminder for everybody to please mute your line. Next, we'll go to Randy Hildreth with WBRC. Randy?
Yes, I wanted to ask about balancing. I know the CDC just said recently, as recently as this week, that cases are on the rise. And then when we look at the COVID data in the state, we see the numbers going up. I know the risk indicator map just came out. And so all of the areas in our central Alabama are in the green. So balancing the information about the COVID cases rising with the risk indicator map.
Yeah, this is a great question and certainly a challenge. The reason that we're here now is that we're hoping to prevent our areas from ending up in the yellow and red zones, right? So we want to be talking to our community and educating everyone while we're in the green to stay in the green, right? And we know the only way we can do that is to continue what we've done so far with the mask, avoiding crowds and gatherings, and then obviously encouraging everyone to get a vaccine as soon as it's available to them. But you're right, we know that once areas are in the yellow, they rapidly escalate to the red areas. And that's when we start to see our community impacted. We start to see children who are unable to safely go to schools. We see health systems affected and unable to provide routine care. And so that's why we're here now early to say, hey, there's some early indicators that things are heading in the wrong direction before we start seeing an increase in hospitalization and deaths like some states in the US are seeing. We need to get the message out now and remind everybody how we've stayed healthy and what we need to do going forward as we approach these holidays and summer travel, graduation events, lots of gatherings traditionally in the upcoming spring and summer months that we need to be careful and safe with.
Okay, thank you. This next question, forgive me, I'm not quite sure who this is from, but they're just asking for general comments on, I guess, church or religious gatherings the next couple of days during this Easter holiday.
Yeah, this is a very important topic, especially in our area as we have a lot of planned faith-related events and meals coming up in the next few days. We know that several faith-based areas and events in our community have stayed safe by either being outdoors or distancing their seating and requiring masks. And that has largely protected a lot of congregations and individuals. But the concern is that with Easter, a lot of these spaces are going to be crowded, packed, more children, and potentially more travelers, family coming in from out of town, right? And potentially bringing in additional new variants, new strains of the coronavirus into our community in less ventilated indoor spaces. So what I would encourage everyone to do is be very thoughtful, plan ahead. If you know that your event is not going to allow you to be distanced and that everyone is not going to be wearing a mask, it's probably not the time to participate in that event. Could you alternatively be in an outdoor event? Could you gather with a small group in a area that is ventilated, or perhaps you and your small group of vaccinated friends or family could gather indoors and watch a virtual service? Those would certainly all be lower risk than gathering indoors in a crowded setting, especially if individuals are not wearing masks.
Great, thank you. The next question from Amy Kingsley. What is the best guidance for gatherings that include vaccinated grandparents and unvaccinated children?
Yeah, this is a question that has come up a lot because I know a lot of our holiday events involve multiple generations. So the guidance is that if the adults are vaccinated, they can be around other fully vaccinated adults in small group settings without a mask. If the children are from one household and low risk for severe infection, meaning they're not medically fragile or severely immunocompromised children, then it is a low risk environment for them to be with other fully vaccinated adults in small group settings. What I discourage is children from multiple households, cousins coming in from out of town, all gathering together, even with vaccinated adults, just because we know that children can spread the virus, they can get ill. And if we're trying to stay in the green zone, we really need to avoid these opportunities for unmasked children from multiple different households congregating indoors.
Okay, thank you. Next question is from Jeff Eliasoff with WVTM. He's asking about the upcoming expiration of the mask ordinance next Friday. What's your advice and guidance for people for after that ordinance expires next week?
Yeah, we're very fortunate that we now have 12 months plus of experience with masks. We have a lot of research and we have consensus in the medical and public health community that masks do work. Masks reduce transmission of coronavirus in addition to the flu and other respiratory viruses. And really what this is an opportunity for us to do in April 9th is to exercise our personal responsibility to follow these experts, follow the public health guidance that's been laid out by the CDC, and continue to keep our area safe by continuing masking when indoors and when in public settings. And I'm hopeful that if we can continue to mask as a community, we can prevent some of these cases and surges that we're seeing in other parts of America and really nationally at this point.
Okay, thank you. Next question is from Miranda Fulmore with WBHM. Miranda, go ahead.
Sounds great. Thank you, Dr. Eaton. I kind of just wanted to follow up on the hotspots. The ADPH has been more quiet about saying, that they're not as concerned about it. But, as some of the questions have already indicated with the mask mandate being lifted on the 9th, how do you think these hotspots could grow or increase? And then also we could see more hotspots with the mask mandate being lifted. If you could just comment on that and give us just an idea with your expertise, that would be much helpful. Thank you.
Absolutely. Miranda, the challenging thing is that by the time we detect a hotspot, the cat is really out of the bag. By the time we detect the cases rising, especially in a time when we're not seeing as much testing in general, when we do see an increase in positive tests in an area, community spread is likely already ongoing. And in general, it's really hard to turn that community around to get the rates back down before you do see an increase in hospitalizations, an increase in deaths. So that those conditions are already ongoing in the context of an ongoing mask requirement. So then if you add to that the relaxed masking that we may see if individuals choose to gather indoors without their masks, if you add that relaxation of risk mitigation to areas that are already seeing increased transmission, you really have a perfect environment for a surge in these communities around Alabama that, as you mentioned, some are already seeing an increase in transmission. Now, I will say that 30 states are reporting increased cases in the last few weeks. We know that in the last week nationally, that our cases have gone up about 17% and hospitalizations have gone up 10%. So these are early concerning indicators. That's what's going on nationally, even in areas with masks, could unfortunately play out here in Alabama and would be amplified if we are seeing communities choose to leave their mask at home.
Thank you. Another question that was submitted, is there guidance for gatherings where people may not be fully vaccinated but may have received their first dose?
There's not formal guidance at this point that I'm aware of. And the hope is that because vaccines are now more readily available, that ability to access your second vaccine in a timely manner will be easier, and we won't see people going, weeks to months where they're in this window period having received their first but not their second vaccine. So there's not formal guidance. We do know that just having one of your 2-dose mRNA vaccine could be as effective as 80% at reducing coronavirus infection. But that means that 20% could get an infection in that window period. And if that is occurring during Easter or other holidays, when you're traveling on a spring or summer trip or celebrating a college graduation, that could be a perfect opportunity to spread coronavirus or potentially get infected. So I would not encourage anyone to act as if they were fully vaccinated until they are in fact fully vaccinated 2 weeks out after their second vaccine in the case of the mRNA vaccines, or after their first and only Johnson & Johnson vaccine.
Thank you. Another question, can you comment on these new studies or data that's showing that pregnant mothers can pass antibodies to their babies? Obviously, as we get closer to Mother's Day, that might be a little irrelevant there.
Absolutely. Really encouraging news. We anticipated this from our experience with other infectious diseases and other vaccines, where we can see some immunity passed either through the placenta when babies are still in utero, or through breast milk when mothers are nursing. And what we've seen in the last few weeks is increasing data showing that those are both true for coronavirus vaccines, that pregnant mothers who then deliver a baby are able to pass on those antibodies to their new infant through vaccination of the mother. And then we're also seeing that mothers who are vaccinated and then are breastfeeding their infants, some of that immunity is passed on through breast milk, which is really encouraging. We know that pregnant women have been especially vulnerable to coronavirus. We've seen some really scary and unfortunate outcomes in both pregnant mothers and their babies. So this is really good news for all of us. And I'm hoping that it's an additional incentive for our mothers and our pregnant Alabamians to go get vaccinated as well.
Okay, thank you. Still have a couple of minutes left, maybe 5 or 10 more minutes left with Dr. Eaton. Another question that we have is, what has this last year looked like for you? What have you learned as an infectious diseases doctor?
That's a great question. I think one thing that I still reflect on is just how hard it has been for the community to know who to listen to. And I think because we're all so diverse in terms of our education and our backgrounds and our awareness, it's been really hard for our community to sift through all the information, including misinformation, and know who to listen to. So I've been grateful that I have trained in infectious disease and public health. I've been grateful for opportunities to speak up. I think social media, and then opportunities such as this, that UAB has allowed me to share my skills, my trade, in a way that improves our community health and hopefully prevents disease. I know someone asked about us being in the green zone currently in terms of our coronavirus rates that are being reported today. And I think my goal is to really serve as an expert in infectious disease and public health to keep us in the green. And I think just reflecting on the last year, it's taught me that clear communication and making sure that we amplify experts is so important in public health. So important.
Okay, thank you. Does anyone else have a question? Okay. Well, I think we will end it there. Dr. Eaton, thank you for your time. And for the media, if you have any other follow-up questions, please feel free to send us an email and we'll try to get those answers for you. Dr. Eaton, thank you for your time.
Thank you.